Howdy y'all, in this video I'm going to tell you what your shit means for you. Yes, we're going to talk about poo, feces, dung, turd, crap, whatever synonym you can think of. I'll tell you exactly what is a normal poo, what should be the correct size, what should be the correct shape, how should it smell. Yes, we'll talk about smell. And wait till the very end of the video, I'll tell you 5 reasons why you need to see a doctor if your poo is out of whack. Guys, let us literally talk about poo. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and don't forget to turn on the notifications so you know when I'm giving a video. And if you haven't already, don't forget to subscribe to my weekly newsletter. I'll put a link down below. So what is in your poo? What exactly is it? So your poop is all the waste products that your body doesn't need. All the excess food, all the things that can't be digested, bacteria, viruses, and anything your body does not need as food is going through. And the reason it actually is brown is that you have all this bilirubin, which is part of the waste product that occurs whenever your red cells break down. So the first thing we're going to talk about is shape. What is considered the normal shape of your poo? Well, like everything in GI, we have pictures and we have images, and we have what's called the Bristol stool scale. Yes, we actually have a scale for poop. Can you believe that? That scale goes from 1 to 7, and right there, smack in the middle, at number 4 is the magical poo. Oh, that is the perfect poo, the golden poo, the awesomest poo you can ever have, and that is the poo that we want to compare all other poos to. If you look at that scale, it is a long, smooth, compact bowel movement with very little splash. It's like a perfect dive. 10 out of 10 from the Olympic scores. Yes, that is the perfect poo, and that is a poo that we compare all other bowel movements to. Now, the occasional change in your bowel habits with respect to shape can be pretty normal. A lot of people have different changes. They can go from maybe from 3 to 4 in terms of the Bristol stool scale, or even 5 or 7. And that's typically not a big deal. We don't really worry about that too much. And people who are on the scale of 1, 2, or 3 typically have very hard stools, very pellet-like stools, and it's difficult to pass through, versus those on the 5, 6, and 7 scale tends to be more on the diarrhea side. Now, like I mentioned before, if you range within the 1 to 3 range, as long as you're kind of within the normal range of what is more likely for you, that's not a big deal. The big problem can be if you all of a sudden switch from 1 to 7 or 7 to 1, that extreme change that's on a consistent basis, that is a brand new change for you. That is what we worry about. And whenever somebody, especially if you're over the age of 50, has a new change in bowel habits, a couple of things could be going on. Number one is that it could be a sign of a blockage inside your colon, whether it's a big polyp or something else going on. Number two is that it could be also a sign of colon cancer. One of the cardinal symptoms from colon cancer is a new change in your bowel habits after the age of 50 years old. And number 3, it could be a sign of some sort of infection, maybe a diarrhea infection or some sort of bacteria inside your GI tract. So if you are within a range when you're always constipated, but kind of within that range, not a big deal. Same thing for the diarrhea side. But if you have a big extreme switch from diarrhea to constipation, especially if you're over 50, and especially if you have other symptoms like a family history of colon cancer, bleeding, weight loss, those are things to not ignore. Now let's talk about the size of your bowel habits. So once again, looking at the Bristol stool scale, number 4, it is a long sausage-shaped stool. Now on the flip side, on around 1, 2, or 3, typically it's going to be very hard pellets, very difficult to pass through, and it may not be collecting together, versus number 7, where it could be all water. What we really want is the large and in charge bowel habit, Bristol stool number 4, but I'll be honest with you, when it comes to size, it's really not that big of a deal unless you have a new change in the size of your bowel habit. So for example, if you are pretty regular, maybe you are on that scale number 4, but all of a sudden you have pencil thin stools, that is a warning sign that something could be going on inside your colon. And something that if I hear from a patient, I'm like, oh man, something could be going on inside that colon. I need to take a look to make sure everything is doing okay. And then lastly, let's talk about smell. All right, guys, I'm gonna give you a little secret here, okay? Just come in closer, a little closer. guess what? Your stinks. I'm sorry. That's what it is. Your poop is not supposed to smell good. I have a video, which I'll put a link above, about why your farts may be smelling so bad and why your poop may be smelling bad as well. But it's okay. It's bowel movement. It's waste. It's something your body wants to reject and get out. So it's not supposed to smell good. However, there are a couple of exceptions to that rule. Sometimes very foul smelling stools, especially if that's a new change, could be a sign of some sort of infection going on inside your colon, whether it's a condition called C. difficile colitis, or some sort of pancreas issue, or fat that is being not absorbed inside your GI tract. So normally your poop ain't supposed to smell good, but if there's a new change in how your poop smells, or if it starts to smell very foul, that could be a sign that something could be going on. Now that I talked about what's normal when it comes to your shape, size, and your smell for your bowel movement, here are 5 things I worry about when I hear this from a patient that makes me think something else could be going on besides just regular changes in your bowel habits. Number 1 is a new change in color, especially if it's red or black. Red stools is never a normal thing to have unless for some reason you're having red beet or red Kool-Aid or something really, really red in it. Red is a sign of blood. And even if you see just a little bit of blood, do not ignore that. I cannot tell you how many people I've seen who've ignored bleeding, who thought, not a big deal, it's just a hemorrhoid. And it ended up being something very, very bad. But also black stools are not normal, especially if it's tarry. Black stools are a sign of some sort of ulcer in the upper GI tract, maybe in the small intestine or in the stomach that could be bleeding, and as blood goes down, it actually changes your stool to become black and tarry. Number 2, and I mentioned this before, is a new change in your bowel habits over the age of 50 years old. Any new change from constipation to diarrhea, or diarrhea to constipation, or change in the size or the shape of your stool, like having pencil thin stools, especially over 50, is never a good sign, and that needs to be evaluated by a doctor. Number 3 is that if you have really bad pain in your stomach and that's new, that is not a normal thing to have. Now, a lot of us have maybe the occasional aches and pains, or we've had stomach pains for our whole life, but a new change in that pain or a new onset of pain is never a normal thing that needs to be investigated. Number 4 is weight loss, especially if it's unintentional. Now, I know all of us are trying to lose weight, but I don't want you to lose weight the wrong way. If you have unintentional weight loss, if you're not trying to lose weight, and you have something else going on with your stool, that needs to be investigated. And number 5, if you have a family history of colon cancer, especially if it's in a first-degree relative and you're having symptoms from your lower GI tract, guys, don't ignore that. Come see me. I'm here for you. I'm your poop guru. I'm going to help you out. But don't ignore that. But these are 5 things that if you're having these issues, you need to speak to your healthcare provider. Guys, I want to thank you for watching this video. My question today for you guys, what questions do you have about your poop? Comment down below. I'd love to hear what you guys have to say. But thank you for watching. Don't forget to smash that like button. Like, share, subscribe, turn on notifications, do all that jazz so that you know when I'm doing the next video. And if you haven't already, don't forget to subscribe to my weekly newsletter where you can get all sorts of great poop tips. Why wouldn't you want to? Come on. All the cool kids are doing it. You want to be cool, right? Guys, well, thank you for watching. Hope you guys have a happy and healthy day. Take care. Howdy y'all, in this video I'm going to talk to you about, feces, dung, turd, crap, whatever cinnamon, turn on the notification so you can get more information. Oh, no, it doesn't make sense. And if you haven't already, don't forget to, I can't speak today. Which is a particular substance that is produced in your liver. It is helped to use to, it's a particular substance produced in your liver that's used for can't speak today. Is that we use a scale called the bristol school. There is a scale that goes from 1, as long as it's within your particular body type. Doesn't even make sense. Now the occasional change in your bowel habits in terms of size and shape. It is a long sausage shape. My question of the day for you guys, what questions do you have about your poop? What things have you tried? What things have done? Oh, that doesn't even make sense. And if you haven't already, don't forget to subscribe. And if you haven't already, don't forget to subscribe to my weekly news. Golly. If you haven't already, don't forget to... God, I can't speak.